So during my career as a clinical psychologist working in private practice and in group health, one of the themes that kept coming up from time to time was when someone died, the unfinished business. Unfinished business is sometimes things that have not been said when someone died, or things that had not been done by the person who had died. Things like durable power of attorneys, last wishes, things of that nature. So today our guest speaker is going to talk about that second part, things that sometimes do not get done that are really important. Much of this has been come to light in our society recently with this book, Being Mortal, that was published a few years ago. So our guest speaker today is Diane Miller, and Diane will walk us through what's being done in our community to inform people about this process and what resources are available for family decisions and decision making. She's retired from a career in public health where she was the director of planning and marketing for the public hospital in San Francisco. She now sits on a patient advisory council at Providence and is a member of their Southwest Region's Advanced Care Planning Steering Committee. And in addition, Diane and I and a few other people have for the last 6 months been going
year and a half
been going through 1 week a month, 1 weekend a month, and talking about this process. And it's been extremely interesting and insightful and dealing with stuff that we didn't think we were going to be dealing with. So Diane will talk a little bit about that and some other stuff. So Diane Miller.
My interest in advanced care planning goes back 30 years. I used to sit on the hospital ethics committee, and that was the place where the difficult cases would come. The people who were connected to machines with zero quality of life, no one able to speak for them. They had never written any kind of advance directive. They were alive only because of the machine. And the physicians or the court would come to the ethics committee to make decisions about what to do next. That experience was the first time that I did my own advance directive. I certainly didn't ever want to be in that situation. The healthcare industry, I think, did a really lousy job of informing people what they needed to do in order to write advance directives. But that's changed in the last 5 years. And I think, as Sherwin said, it's changed because of the book Being Mortal. And there's been a grassroots effort of things like our get-together, death cafes, of television programs, where people on their own are coming together to talk about how do you want to live, how do you want to die. And since then, Providence has really taken a lead in this. Their foundation has allocated $500,000 over the next 3 years to make sure that people are properly trained. Individuals know about advance directives, providers, nurses know about it. The forms become more realistic, and there's real training for people on how to actually fill out an advance directive. So what is it? It's really doing your what ifs. What if I'm in an accident? What if my husband's in an accident? What do I want to happen for me? What do I want to happen for him? And it really takes place in a couple of different arenas. The first one is some sort of self-examination. What kind of quality of life do you want to have? What's unacceptable for you? Who do you want to be your spokesperson? It doesn't have to be your spouse. And have you actually talked to the people who are going to make decisions for you? And you have to do all of those things before you actually write anything down. And then you complete the documents, have them notarized, and make sure that they're filed in a way that people can actually have access to them. So I want you to do some pretending for a minute. Sitting right here, right now, you just had a severe allergic reaction. You're not breathing. Somebody's going to call the fire department, call the paramedics. How ready are you? Is your close relative, do they know what you want? Have you ever filled out a form? Where is the form? Or you just get a phone call and you find out that your spouse has been in an accident. Person's not breathing, been taken to the hospital. What kind of decisions are you going to make for that person? Do you know what they want? Would their doctor know what they want? Your grandmother, perfectly healthy yesterday, falls in the emergency room, they want to do surgery. Do you know what they want? Do your siblings know what they want? Are you in agreement about that? Have you had the conversation? Who's going to talk to the doctor? Who's going to say yes or no? You can't do that at the last minute. If you've been in an emergency, you know that everything is goofy. You don't think clearly, and things move so fast, and you really aren't sure what it is that you're supposed to do next. Oh, one more. A friend of yours has, her cancer has come back, and she does not want to have any further treatment. How do you respond? Are you able to be supportive with her or his decision? Or are you uncomfortable with it? Who's going to talk to that person as he or she is dying? So what are advance directives? Who in this room has one completed? Very good. Very good. Whose spouse has one completed? A little bit less. Do your children know where the advance directives are? Do you know where they are? What if you're traveling? How would you get your advance directive? Okay. The advance directives comes in two parts, and sometimes people who filled theirs out maybe 10 years ago aren't really sure what it is, so let me just go over this, even though a good number of you have it. The most important part is naming somebody who can speak for you. And again, as I said, it doesn't have to be your spouse, but it's somebody that you have to have had a conversation with. They need to know what your wishes are. And then you need to have a backup person. And then you need to have a third backup person. Because your first backup person may not always be available. The second thing is, in your durable power of attorney, this is where you write down what you want or what you don't want in terms of care. Together, that becomes your advanced care planning document. The other one is a post. Who has one of those? Okay, smaller number. The post is a physician's order, and it's different than the advanced care planning in that the advanced care planning is advisory. It tells the doctors, it tells the hospital, it tells the paramedics what you would want. A pulse is actually a doctor's order. The doctor signs it and you sign it, and you say what it is that you would want to be done. When the paramedics are called, the paramedics respond to the pulse in exactly the same way they would with any doctor's order. So the advance directive is something that really everyone over 18 should have. Your kids should have one. If your kids are over 18, your friends should have one. The pulse, though, is really for people who are sick, who have serious illnesses, or have become part of the frail elderly. And the way that the paramedics would know that you have a pulse form is that you keep it on the refrigerator. So if you visited any friends who had a green form hanging on their refrigerator, it means that if the paramedics are called and the form says do not resuscitate, the paramedics will not resuscitate. So why do this? Most people, 90% of the people, say that they think that this is important. You're an unusual group because for a total population, only 20% of the people have actually had any kind of conversation about that, even though they may think it's important. 82% of the people say that it's important to have this in writing, but less than a quarter have actually done it. 80% of the people said that they want to die at home. 20% do. 60% in hospitals, 40% in skilled nursing facilities or adult homes. That's a very sad number, with so many people saying that they want to die at home. Again, why do it? It increases the likelihood, doesn't guarantee it, but it increases the likelihood that you're actually going to be able to have your wishes followed. And it means that you've also had the kind of conversation with your loved ones and with your friends about what it has meant to spend time on the planet, what was really good for you, what you've identified as good quality of life, and what are the things that you want to finish before you die. The other thing that this process takes you to is that when you have received a terminal illness, you don't freak out in exactly the same way, and you're much more likely to enter palliative care or hospice care. Right now, most people who enter hospice enter about 2 or 3 days before they die. And there are so many more services and help that could be available to people if they meet their diagnosis early. So what steps can you take? This one says first talk to your loved ones. I put one before that. And that is really your own self-evaluation. Whether you do journal work or some sort of meditation or however you look at within yourself, what is it that's important? And then have a conversation with the people in your life who matter, your loved ones and your family and your good friends. And you do that before you actually get into any documents. One of those people that you've talked to is your healthcare agent. They've agreed to do it, and then as I said before, and then you have 2 backups. And then you complete the documents. I think I want to stop here and ask Sherwin whether before we do any further, anything that you would want to add?
Do you have any of the 5 questions, some of the examples of things they would fill out in your slide thing?
I don't. I have examples, and I can pass them around of different organizations and the forms. Is that what you meant, like the 5 wishes?
Or even just, reading some of the questions so they're more direct in terms of what they'd be asked to fill out.
So in the 5 wishes, which is one of the forms that you can use to fill out your advanced care planning, you identify the person I want to make decisions for me when I can't. Is that what you mean? The kind of medical treatment I want or I don't. How comfortable I want to be. That's a good one. How comfortable do I want to be? Because you're asking yourself whether or not you are willing to have some level of pain in order to be aware. And some people don't want any pain at all. Kind of identify that early. Okay, I want medicine. I don't want to feel any pain. Other people, it's like it's more important for me to be awake, and I'll deal with the pain. How I want people to treat me, and what I want my loved ones to know. That's a good one. So rather than waiting for your deathbed statement, what is it that you want to tell your loved ones and your friends? Have you had time to come either make peace with a problem that you've had, or have you told them how much you appreciate them? Have you shared with them what your wonderful life experiences have been, or what insights that you've had? Again, you want to do it when you're able to think clearly and when you can actually enjoy the conversation. Anything else, Sherwin? So what resources are available? One of the things that Providence has taken on with the funding from the foundation is revising the forms so that they're much more in-depth and help you elicit sort of what your true feelings are about these issues. And they've set up a whole cadre of trainers who will work with any group to help them fill out forms and to actually talk about what all of this means. They've also done training with all of the primary care providers and with the hospital staff, so that not only to ask about this, but to make sure that people's wishes are honored. And then they're also working on documentation so that your advanced directives are going to be available. They'll be on the screen when you check into the hospital. Two of the two websites that are really helpful for having this conversation, one is called The Conversation Project and the other one is Honoring Choices. Honoring Choices is a collaborative effort between the Washington State Medical Society and the Washington State Hospital Association. They've come together to make sure that there's a uniform approach within the state of Washington for how this is addressed. And the Conversation Project is more informal, and it helps people to get the conversation started. So it has really good prompt questions. Then National Health Decisions Day is in April. Think of it as death and taxes. In the middle of April every year, there's going to be an effort to have people be aware of their, making sure that they have done some sort of healthcare planning. This year on the 18th, which is a Tuesday, it's from 6:30 to 8:30, there will be an open forum here at St. Martin's, sponsored by Providence, with a guest speaker who will talk about advanced care planning, but also people available to update your documents and a notary there to make sure that they're properly witnessed. So the 18th from 6:30 to 8:30 here, and then on the 19th and the 21st, midday at the hospital. You can come in, fill out forms, have your friends fill out their forms, and there will be a notary there to make sure that they're documented. I think we covered most of this. I'd really like to get into your questions. So, yes.
So, I think I tripped on something in that you're saying that these documents don't compel anybody legally, they're just advisory.
Oh,
Tell me
no.
more about that.
They're advisory in the sense that you're telling the provider what you want. And the person who is your advocate has to sign off on anything that they're going to do. It does not apply to the emergency room, and it doesn't apply to the paramedics. And the reason is the documents aren't available when the paramedics are called, and the documents often aren't available when you're in the emergency room. But once you've entered into the healthcare system, then your advocate is the primary decision maker. So if you've named, let's say I've named Sherwin. Sherwin would have primary responsibility rather than my spouse because I've named him. If you haven't named anyone, and you have a large family, your family all sort of has to agree. So if you have 4 siblings, and 3 siblings say whatever, I know what Sally would want, but the 4th sibling says, no, I think that God said that we shouldn't do anything. Nothing could happen unless all of them agree. So it's another reason to make sure that you have a documented, durable power of attorney. Yes?
So the post, which is new to me, that is responsible for the paramedic treatment. And is that applicable in just Washington, or is that something that you see commonly in many states?
Many states. Many states. I don't know if that they're all green, but in Washington, throughout the state, they'll look like this. Okay. Way in the back.
On the 18th at St. Martin's, is that April 18th?
Yes, it is.
Okay,
Yes.
thank
Yeah,
you.
the death and taxes. Yes.
April 18th.
April 18th. Yes.
Does the post need to be signed by a physician?
Yes. Yeah, it's totally useless without a physician's signature. And the physician talks to you, so it actually documents the conversation and explains to you that if you don't want to be intubated, what this would mean if you're not intubated, what it would mean if you have CPR. And so he writes in your chart too that you've had this conversation, and that's why it's actually a physician's order. Yes?
So is a post typically connected to a specific diagnosis?
It's connected to 2 things: a specific diagnosis that is on its way to being terminal. So somebody who is a stage 4 cancer patient would have something like this. Or somebody who is frail elderly and has maybe multiple health problems, but not necessarily cancer. And that's why it's a conversation with the doctor. Somebody who's my age might be in poor health, and so they would have a pulse. Somebody who is my age and is in really great health might not have one. Sure.
So I'd like to say that, like, I sat with both my parents who died and some friends who died, and it is really sacred space, and one of the things I learned from that was how important knowing their wishes were. Filling out these forms that Diane and I and others have done over the years, last year or so, one of the things I did when I put this all together, I sent this to my children. We're in a society, we often deny death, and I think that's a big mistake. But I sent it to my kids, and both of my adult children wrote back or called me and said, thank you so much for doing this, that it helps take away the responsibility that they have to second guess what my wishes would be. So it is a gift to our children and to those behind us to do this. And the other thing is that some of us who see ourselves as being younger, just think of those instances where, like this last year, the guy was driving in Seattle and a tree fell on him. Mm-hmm. So it's not just these long-term terminal illnesses that take us out. We just can't predict what's going to happen the next day. So this thing about when you're 18 and over, you should have this stuff done, I would really recommend that you think about doing this. I think it's really important for all of us. Thank you.
Okay.
Yes. Oh,
Oh, go ahead. What's the difference between a living will and what you're saying?
it's the same thing. Same thing. Yeah, there's so many names: a durable power of attorney, healthcare agent, healthcare proxy. But essentially, what you want are two things. You want somebody who you've designated who will be your voice, and then something that you've written down that says what kind of quality of life you want to have. And I just want to end with...
Well, can I ask you one question first?
Oh, yes.
So this may be outside the scope of what you're going to talk about, but the fact that so many people don't have one of these completed.
Yes.
I have this theory, and I want you to tell me whether you think I'm nuts or not, that one of the factors contributing to the sort of rapid increase in healthcare costs is that end-of-life decisions aren't planned, and so things get done that people maybe didn't even want, but end up costing.
Yes. I mean, the number of days that somebody spends in critical care. If you have made a decision about how you want to spend your last days, it wouldn't be in a critical care unit. And so not only would your family not have that expense, but really the whole industry would not be experiencing all of this demand for critical care. I had this wonderful video that unfortunately we couldn't show, but if you have a chance, pull up Z-Dog, Z-D-O-G-G, and it's done by an emergency room physician, and he does a rap song to what it would be like to actually be in a critical care unit. And I've watched it at least 10 times, and I still get chills. And it really gives a picture of what it's like lying there and having all of those things happen to you, and no one being able to do anything about it if you haven't had an advance directive.
Would you want to be a cartoon?
Oh, the cartoon is, I can't read it from here.
Don't freak out. It's just to save the date.
Oh. Save the date. Oh, and Sandy Adams is the person at Providence who's been hired to really run this program. And if you have any questions about this, if you want to have a facilitator come out to a group of friends and help people fill out forms, or just give a presentation, contact her, and she would have somebody available. Yes?
I really appreciate what you said today, and Sherwin, you hit it on the head, but I'm living this experience right now. I've been at the hospital the last 2.5 days, very personal friend, mayor of Rainier, my brother-in-law, went in for a just outpatient, okay, little procedure, flatlined on the table. CPR for 15 minutes, okay, and shocked 3 times, no response since Tuesday. He is still alive on life support in CCU. He has a directive, okay, but how important is this? It's very important for your kids, 18 years old and up, even younger than that. Get your family a directive so people can have their wishes done. You've said this very well, and how important is it? You may take for granted your life that you're in great health. Randy Slice walked into the hospital to have a little procedure, and he flatlined. Any one of us, a tree could fall on the car. We're there, folks. You don't know how important this is. If you want your directive to be done, get it done.
Well, yours, and then the person, you're the voice for many people, for your spouse, maybe for your children, maybe for a good friend, and you really know what they want. Have you talked about it? And have you talked about it in the last 2 years? Thank you.
Thank you very much.
Diane, thank you for a very important topic, and one that I'm guessing all of us have had some experience like Burl's articulating somewhere in our recent past, and so it is important. As a matter of tradition, we donate a book in your name to the Southside Reading Foundation, so I'll give this to you and ask you to sign it down at the table. I'm terrible at trying to find a book title that matches your talk, and I'm way off on this one. This is Harry the Woodpecker's Search for a Home. So. Yeah, that's a stretch, but we'll take it.